Hi, my name is June Kamei, and for this VoiceThread, I'd like to give a quick introduction to the steps you should take in data analysis. Although that might seem a very broad topic, there are some common steps that we all can do to make sense of the data that we collect in an organized and efficient manner. Step 1 is probably one of the most important things you can do at the onset, and that is you should take a moment to review the original question of your study. This is so that you can be sure that at the end of your final steps of data analysis, you are sure to have answered that question. There may be other considerations that pop up along the way, and that's why statistics is such a powerful tool, since it lets us address those considerations in an objective manner. But first and foremost, remember to state if you found the main hypothesis of your research study was correct or not in the way you originally had anticipated. Or if this was an exploratory qualitative research design, you should be sure to have a clear explanation of the phenomena you found based upon what your data suggests. So bottom line, take a moment to do a complete review of your research report introduction and what your anticipated findings were as initially outlined. The next step is to think about how to break down your data analysis in terms of the two main statistical categories. Descriptive statistics allows you to do the type of analysis that helps give your audience, or the reader of your paper, an idea as to who were the participants in your study. Even if this was a systematic review or a case series with only a few people involved, you must provide some foundational information as to what kind, how, and where your data was collected. This is particularly important when you later wish to discuss how your findings related to those reported in the literature, since differences in subject populations can affect what the values of the outcome measures in question turn out to be. For example, a population of individuals with Hoehn-Yahr stage 1 Parkinson's disease may have different normative values from those who have Hoehn-Yahr stage 3 Parkinson's. On the other side of the slide, you can see that inferential statistics can be a very important tool to allow us to know if there are significant differences between the different groups or data sets that we are comparing. Since these conclusions are based upon probability and sampling error, it is very important that we follow the sometimes strict guidelines that are provided for each statistical test. Using the wrong test can result in wrong conclusions. Not good. If we look at this Portney and Watkins figure, which has been tweaked out to emphasize the three main types of research designs, we can relate this information to the kind of research design which was used for your study. For example, suppose you decide to investigate a patient population where the outcome measure used were the individual Berg balance scores for each person. You might wish to use the exploratory research design if you had no idea if there was any relationship between these two factors and wanted to find out. In this case, it would be incorrect to start citing conclusions at the end of your data analysis that suggested a cause and effect finding, which is more appropriate to the experimental research design method. Even if there was a significant statistical finding found with the Pearson or Spearman correlation test you just ran, where p was less than 0.05, it would be incorrect to state that age causes Berg balance scores to become decreased. Rather, you would need to state instead that there was found a statistically significant inverse relationship between age of an individual and their Berg scores. As a reminder, when you're citing this information, whether in a poster, a figure, a slide for your presentation, or for your written research findings, they should always be listed in a standardized manner, such as the APA format as required in my classes. The type of statistical analysis can take many shapes. This slide is meant to serve as a reminder that you can do several different kinds of tests for the same data set. It just depends upon what the specific statistical question is at the moment. If, for example, I want to know about the average age plus or minus the standard deviation of my patients, the years of experience and training, as well as how many men versus how many women were in each group, I would do a univariate analysis, taking each characteristic or variate and finding out what that number was. On the other hand, if I wanted to do a bivariate or two-factor comparison, like age and Berg scores, or even more than two factors, like comparing the intervention each group received, the gender, and the years of training, I could do a multivariate analysis. Keep it simple when you first start, but also know you really do have many choices at your disposal. A variable is the most elemental description of your data. Take a moment and consider carefully what those descriptors are in your study and how they are used to answer your research question. The next 4 slides are related to the basic terms you should be very comfortable with. Knowing which is an independent versus a dependent variable is important to not just experimental design, but may be also referred to in some exploratory design methods as well. Either way, SPSS may ask you to identify what kind of variable you're inputting into your spreadsheet when you go to the variable view portion of the program. Look through these slides and confirm that you know how your study relates to these terms. If you are unsure of what you should input, you can go to the PowerPoint notes provided during my class, to Portney and Watkins textbook, or to layer tutorials found online. There is a great deal of helpful resources at your disposal. This last slide briefly outlines the recommended steps you should follow for your data analysis. By the end of this process, you should not only have your answers to the originally stated hypothesis or purpose in your introduction, but also be able to clearly address all the possible combinations of factors that you think may have had underlying influences to those primary outcome measures. Did age influence what the means of the dependent variable measures were? Was there a significant difference in the dependent variable measures for people presenting with different severities of the same disease? What about differences among data from different clinical sites? There are many, many different considerations you could look at when it comes to your dependent variable outcome measure values. Pick the ones that you think are the most relevant to report on, and make sure you do the correct statistical analysis so you can speak knowledgeably about them. Importantly, you can later choose the most important findings on your results list and make graphical aids to help explain these findings to your audience. I hope this brief introduction has been a helpful start to your data analysis journey.